Hey guys, I decided to do my first pharmacology video on routes of drug administration. The six main administration routes are enteral, parenteral, inhalation, topical, ophthalmic, and otic. I'll break them down per slide to give you an idea of what each of these kind of do and what they mean. So enteral is basically any kind of drug that is orally ingested. So that can be through the mouth, under or on the tongue, and oral mucosa. So basically, anything that is through the mouth would most commonly be NSAIDs or Aleve, which is a pill. These are anti-inflammatory type medications. Under the tongue or on the tongue, a very common medication is nitroglycerin. This is important to know because although it is something used most commonly in the older population, it is something to have a knowledge on if you were to work in that population. Basically, nitroglycerin increases blood flow and is most commonly used to help with chest pain. And then oral mucosa is anything that's kind of applied to the mouth. Most commonly it's like an oral gel, and they're usually like applied to like blisters or mouth sores. The next route of administration is the parenteral, and this is basically anything that is injected into the internal body compartments. Although we typically do not do injections in the athletic training clinic, I think it's important to know the sites and exactly where the injections occur. In the instance you have a patient that does get any of these injections, you have a knowledge and background of exactly what they had done. So the first site is subcutaneous, which basically is just right beneath the skin. Something typically used and something you actually may see in a clinic is insulin injections. These are typically used in diabetic patients and like I said, are just administered right beneath the skin. Intramuscular and intravenous. So intramuscular is injected into the muscle, and intravenous is applied into the blood flow. Although again, something we will not typically see. Morphine is actually injected into the intramuscular portion, and I think that's important to know because although we may not administer morphine, patients may get it administered at a hospital and then come see us, and it's important to know exactly where the medication was injected. Intrathecal basically is just into the spinal fluid, and again, although it's not something we would see, I think it's important to know that anesthesia is typically injected into the spinal fluid, which is again the intrathecal, and it's something that may occur again if we had a patient go to the hospital and then return to us at a later date. Intra-articular and intrasynovial. Basically, intra-articular and intrasynovial is either into the joint or into the joint fluid. The types of medications that are administered there commonly are usually right into the joint, as you can see in that photo, and usually it's a corticosteroid, something to help with healing or inflammation. Most commonly known into like the lateral epicondylitis area for chronic type injuries. So the next route is inhalation. So these are drugs that are administered through inhaling in a sort of gas. These usually go to the lungs. Most commonly albuterol, which is as you see in the photo below, a type of medication that is inhaled. It's most commonly administered to asthma patients, and that is typically something we would see in the clinic since asthma is pretty common. Topical is any type of drug that is administered to the skin or mucous membrane. So basically the site would be the skin surface. So these could be topical creams or even like nicotine patches. These are usually fast acting because they're applied directly to the skin. Ophthalmic is another route. Basically, these are drugs that are administered directly to the eye. Commonly known, they're like eye drops. Timol is a type of eye drop used in glaucoma. So although we may not see patients with glaucoma, it's good to have a knowledge. But also, medications for different types of eye infections are also directly applied to the eye. So otic, these are drugs that are administered into the ear. So very similar to eye drops, they're applied directly into the ear. Corticosporin is a type of antibiotic that is used for any type of ear infections, which we may see in a younger population. So if you were in a high school setting, you may see ear infections a little bit more than you would in an older population. And then a couple of uncommon sites, but something you may see from time to time depending on the population you work with. Rectal, which basically means it's anything that is applied directly into the rectum. Something that is applied are suppositories. A common one is acetaminophen. These are usually given to children to apply. So although we may not see it typically, I think having a knowledge of it and understanding that it's still a pain reliever, it just goes in a different direction. I think that's important to know. Another site is vaginal, and basically that's anything that's applied to the vagina. Clotrimazole is an antifungal cream, and that is something that would be applied directly to the vagina.